Hi, I'm Louise Chunn, I'm the founder of Welldoing, and I'm here today with Wendy Bristow, who's a therapist, and we're in her consulting room in Islington in North London. And Wendy and I are going to talk about what happens when you first come for a therapy session.
So the thing I get asked a lot when people say they ring up about the first session is, so what do I do? How do I get it right? What happens? What's supposed to happen? And I always tell them it's their time. People often do kick off their first session by talking about what brings them to therapy. That is usually the best thing to do, to start with top of mind. And people normally come because they're in some kind of crisis, or they've found that, say, something like anxiety has been building up and they can't cope anymore. It's become unmanageable.
So do you have questions that you typically ask, or are you allowing them to talk in whatever way they feel like it?
Yeah, some people come and they just start talking. Other people are quite nervous and they don't kind of know what to do, and I might ask them a few questions to start with that are very basic, kind of factual things like, how old are you, where do you live, where do you work, and that can help people get going. And sometimes, but this happens less often, people come and they want to ask me questions first, like, how do you work?
How does this work?
What do we do? Often they say, do I just start talking or not? And we have a little conversation about that.
Do they ask you about your training?
Sometimes, yeah. Sometimes.
Or do they ask you about how it works? You know, the theory behind it? Or do you think they've already...
Most people have done a bit of looking, on a site like Welldoing, there's lots of wonderful information about how therapy works, how different therapies work. I think a lot of people are very confused about that. They don't, when a therapist is training, there are these different modalities. There's psychodynamic, integrative, humanistic, CBT, now there's mindfulness therapy, things like that. And it's very confusing, and people often don't know what they're getting, and people often don't mind what they're getting.
How important do you think it is?
Well, the thing that is the most important, and this has been proved by research now, is it's the thing that helps the what we might call the healing process is the relationship with the therapist. It's the most important thing is to make sure you find the right therapist for you. And because it is a relationship, and the relationship is helpful and kind of healing in itself, like any relationship, you need to kind of click with the person. So that's very important. And so when I do a first session with people, I always say, there's absolutely no obligation to keep going with me. This is like a tester to see if we can work together.